Hey, welcome back to Healthcare Consumerism Radio. This is Doug Field, along with my co-hosts Ron Bachman and Brent Macy. And during this segment, we're going to talk about really a much talked about subject, and that is the growth of ancillary benefits via the impact of ACA and specifically also private and public exchanges. And to talk about that, today is Carlos Ferrara, who's COO of Solstice Benefits and Solstice Marketplace. Good morning, Carlos.
Good morning. How are you doing?
We're doing fantastic. How are you?
Great. Thank you for having me here today.
Yeah. Give our audience, before we kind of take a deep dive into kind of dental and vision, so give our audience background and overview on Solstice Benefits and your new marketplace as well.
Sure. Solstice Benefits has been around pretty much since about 1997 as a dental standalone organization. We've transpired into much more of the ancillary benefits throughout the years, vision and a little bit of life, et cetera. We're in about 23 states where we serve members, close to a little over 600,000 members. As a standalone organization, we have the flexibility of being able to be much more nimble rather than a larger healthcare company may have other ties to the medical drives, et cetera.
Talk to us about, and you have a marketplace now too, correct?
Yes. So what we ventured in with the onset of the affordable healthcare is creating a marketplace that's geared specifically to our brokers, to the agents who have been left out on the cold, as you may imagine, where they don't have access to the same type of bells and whistles of these marketplaces that other larger organizations may have. So our marketplace, again, geared towards the individual broker and the smaller organizations where they need a lot of flexibility and create a soup-to-nuts added value to their clients, straight from the enrollment and the plan enhancements all the way through billing and eligibility.
Very good. Talk to us about what you see as the impact on dental and also vision via the ACA and the emergence of the private exchanges.
What we have found, surprisingly, is the lack of knowledge. As we all know, over the past year and a half or so with the Affordable Care Act, there have been a lot of questions about what the requirements are. And we do have a lot of questions as a consumer and also as an employer as to what's going to happen. Now you take into account that it's a dental or an add-on, and there's a lot of misconceptions out there that dental is just automatically included in there, especially in the federal and state-driven exchanges, when in reality what we have there are the only requirement there is a pediatric benefit. It's interesting to note that when we talk about dental, not just for the children who are probably going to use the benefits the least, because obviously as children the teeth have matured, et cetera, that's the one thing that is absolutely an essential health benefit. If you look at the last couple of years, according to the National Association of Dental Plans, 99.5% of all dental benefits provided to employees came from standalone companies.
Carlos, Ron Bachman here. Let's focus on that a little bit because I think you're exactly right. There's a lot of confusion out there. Under the Affordable Care Act, there is a requirement for things called essential benefits. And in that list of essential benefits that employers need to include is pediatric dental, children's dental, if you will. What is happening in the marketplace? Because historically, the standalone programs like yours have been very flexible, have been faster movers in trying to be responsive to consumer needs. And now that the pediatric dental is a part of that essential benefits, is that where insurance companies and that are offering the medical benefits are adding that, or are you picking up that pediatric dental piece on behalf of the insurance companies, or is it now split that children get coverage under the insurance plan and you're providing the standalone? So you can see why there's a lot of confusion. So try to straighten it out for us.
Sure. Well, here's the first thing. The Affordable Care Act states that the essential health benefits have to be offered. It doesn't mean that they have that employees or members or whoever enrolls has to take it. Mm-hmm. So what we have seen, surprisingly, is that a lot of people who do purchase through the exchanges, the federal and state-driven exchanges, is that they go out and they buy a standalone dental product rather than just looking at it from a pediatric perspective. Because as a family, as we all know, who may have children and spouses, et cetera, we want to have something that covers everybody, not just the children. So the standalone organizations like ours have offered, that same benefit that you would have as a group level, but for the individuals. So again, as long as it's offered by the medical plan on the exchanges, that doesn't mean that someone has to buy it.
So you're providing the dental benefits for both the children and the adults in a package so that the employer doesn't have to purchase that through the insurance company. Is that right?
That's exactly right.
Well, now, in the when mental health was, as a parallel, was added under federal law as a requirement, many of the standalone mental health benefits, which were very effective, again, as being standalone operations, more flexible, like your dental organization, many insurance companies wound up taking that in-house. And the standalone or carve-out plans, if you will, kind of took a hit in the marketplace. Is the same thing going to happen with the standalone dental, or the fact that they are requiring some coverage of dental actually expanding your business? What's happening there?
Well, it's an interesting dichotomy of what's going on. I come from a background of larger insurance companies, and larger insurance companies I've always had a dental company or dental services, but they themselves have gone through a restructuring where they've absorbed what used to be the dental arm of that insurance company, and absorbed it as just a product line, just like you would anything else out there, like you said earlier, like the mental health. Unfortunately, what we found is that dental is such a different animal. It doesn't use the same type of codes that we have our own. We don't have diagnostic codes like you would in medical. We don't have the same type of ICD codes. Our claim forms are different. So we've essentially taken the mouth out of the body. So again, the members will continue to want that same type of dental overall package that offers them the more flexibility, greater benefits, rather than just an add-on where, okay, your cleanings are covered, but that's all it is, and everything else is just set up at a discount.
Carlos, do you see the same impact on vision as well?
Not to that extent, but it is happening as well. There's a lot of the competition in the vision market is a lot stronger against the insurance companies, the bigger insurance companies. So there's some vision plans out there that have a lot more stronger contracts and therefore greater discounts for the employees and the members.
Okay. Now, the insurance agents out there are really excited about offering up new products as like vision, dental, legal insurance, all sorts of other options out there. Is that what you're finding in the marketplace? Because as commissions, if you will, which has sort of been the base compensation for insurance agents on the medical side, with that being cut under the federal bill limitation on medical loss ratios and those sorts of things, brokers seem to be turning towards consumer interest towards these alternative benefits, these supplemental benefits. Is that what's happening in your marketplace, the way you see it?
Absolutely. The agents and brokers who have offered all this type of consulting to their clients for many years, as they lose some of those clients into the exchanges, they're looking for other avenues. And obviously the dental and vision, dental is always being the second most required benefit. It is a great foothold for a broker to not only keep their clients, but also to open up some new doors. We've done a lot of things to add value to our agents, just as, for example, wellness plans, where we offer those together with the dental and vision to give a more complete package for the broker to offer the groups, which essentially will help their medical costs as well. But again, it's a lot more added value than we had seen previously.
Now, Carlos, and you just mentioned the wellness offering coming in with the dental and the vision, and we've run into it in the past where the vision and the dental companies really talk first and foremost about dental wellness or vision wellness, and not just your checkups, but what's the value that a vision and eye exam can tell on your overall wellness, and the same thing with dental. Do you help educate the brokers on kind of those different aspects of those two different products?
There has been a lot of conversations with overall health, although earlier I mentioned how we took the mouth out of the body. Conversely, we put the mouth back into the body when it comes to overall health. There is a lot of specific correlations between the oral health and cardiovascular disease, diabetes, et cetera. Same thing with ocular care. So when in today's market where you go to a dentist and instead of just going for a cleaning and a filling, your dentist is going to make sure they're going to look and make sure there's no oral cancer going on. There's a lot of exams going out there, pretty exciting stuff, where they actually can tell based on the bacteria that you have for your periodontist to look at it and tell you whether that bacteria is correlated to cardiovascular disease or diabetes. So imagine the opportunity for you to go get your cleaning and find out that you better go see a cardiologist as soon as you walk out, and in essence, improving the overall health.
Carlos, what's you have built a very interesting tool and income enhancement tool for brokers. What's your biggest challenge getting them to embrace what you're doing?
I think there's a little bit of doubt and uncertainty as to how easy it is for them to this become their package. Those agents that have looked at it and understand it have really embraced the product and gone straight to market with it, and we've seen a huge surge of business coming in through those. There are others who are looking and just sort of waiting and seeing to see what's going to happen in the marketplace. Should they get out of it? Should they not? But so far, those brokers that we have, and we have a pretty decent amount of them who have joined us, who, by the way, may not even have had our products in the back. They don't necessarily have to offer our dental and vision products. They can have whatever they have today because they're comfortable with those. We've seen a huge number of employer groups staying on board because of the added value benefits.
Now, Carlos, we've got about a minute left in the program, and looking at the distinct pieces of your business, kind of give our audience one or two good takeaways on what they really need to understand about dental, vision, and then the marketplace that you all created.
What's really important, I think, to take away, like I said earlier, is that the dental standalone product is something that adds a lot more value to the family, adds a lot more value to the individual consumer and to employer groups who may not want to just follow through whatever their health carrier is supplying them. That for the agents, coupled with a marketplace that offers the flexibility of whatever plans they have, whatever carriers they currently use today and are comfortable with, to offer that added value and continue to maintain their clients rather than seeing them ebb away.
Hey, Carlos, we really appreciate having you on the program. Hope you have a great weekend. To our audience out there, we will be covering supplemental and ancillary benefits at Forum, and especially the exchange side of it as well. So you can find more information at the conference on that as well. Again, Carlos, thank you so much. Have a great weekend. And to the rest of our audience, please stay tuned for the next segment of Healthcare Consumerism Radio.